Hello, good evening. Welcome to North West Tonight with Roger Johnson. Our top story: inadequate personal protection. The doctor's surgery which turned to DIY shops and asked patients for help.
It is. I mean, we call it, a lot of our colleagues call it a sandwich making kit.
There have been 88 new deaths announced today, the highest so far. Also tonight, reunited after being stranded. Susan's back home with John, just in time for their 50th wedding anniversary.
I couldn't believe it. I was like a hot potato waiting for it to come through that door.
All dressed up but nowhere to go. It's Ladies' Day with a difference at Aintree. And who's giving you a helping hand during the crisis? We want to help you to say thank you to your everyday heroes. The number of coronavirus cases in the northwest rose sharply again today, as did the number of deaths. 88 were recorded today. That's the largest number so far as the outbreak intensifies. And a group of northwest GPs has launched a public appeal for personal protective equipment, saying that they need it for their safety. Staff at the Wilmslow Health Centre say that they started by going to DIY shops to get the kit they require, but they are now closed. Here's our health correspondent, Jill Dummigan.
The response has been fantastic. We've got people making visors for us. We've got children sending in FFP3 masks that we can wear.
Yesterday, this surgery put out an appeal for protective equipment to their own patients.
We've got bodysuits which can protect our carers who are going out to people's homes.
So all this stuff's been sent in by your patients?
In the past 2 hours.
The GPs here put this appeal on the surgery's website after seeing what they've been sent by the NHS.
This is what we've been issued with. This is a flimsy apron. Doesn't give us any covering for our arms. And we call it our sandwich making kit. This is the mask. It doesn't have a filter on it, but it does give us a degree of protection in certain circumstances.
This surgery also operates a hot site where patients for the whole area with suspected COVID-19 are assessed. The doctor here is well kitted out. So where did he get it from?
So I sourced this PPE myself. I bought the boiler suit from one of the local DIY shops, as the mask as well.
Just to get this straight then, you've bought a lot of it yourself from DIY shops?
Yeah, a couple of weeks ago when this was all set up and we were looking at what sort of protection we may need, and we felt to protect ourselves and the doctors working here to make sure we can still work here and look after our patients, we thought it was necessary to try and source them on our own.
Yesterday, NHS England updated its guidelines for clinicians working on the front line within 2 metres of someone thought to have COVID-19, with a recommendation to wear apron, gloves, surgical mask and eye protection, depending on the risk.
But a number of health professionals have told us that they simply don't have the equipment they need to feel safe in their jobs.
The union, which represents many of them, is urging the government to provide more.
Anybody who's coming into contact with people who are potentially infected with COVID-19, they need and they want to do their jobs, but they want to do it safely. So we want the right equipment to be in the right place at the right time, and unfortunately the right time was yesterday and last week, so it's certainly today and tomorrow.
Back at the surgery, another donation arrives.
They need all the help they can get. They're doing an amazing job keeping us all safe, so it's the least we can do.
The government says it delivered nearly 27 million pieces of PPE to workers just yesterday, and this new guidance exceeds World Health Organisation guidelines. Jill Dummigan, BBC North West Tonight, Wilmslow.
The issue of PPE is one which has been making headlines for a week or so now. The problems don't seem to be going away, and as if to underline that, within the past few minutes, Macclesfield Hospital has just put out this tweet. It's an urgent appeal for surgical scrubs, and they're asking if beauticians or people running therapy centres can help them out. Well, a field hospital could be set up with